Hello, everybody. Thank you very much for joining us for today's episode of Physicians on Call. We're very happy to have with us today Dr. Lauren Roper, who lives in beautiful Western Colorado. She's a general dentist, but she has a unique passion for the oral health and whole body connection. So we'd like to thank you, Dr. Roper, for joining us today. We're very excited to have you here. And we'd like to start with just asking you, tell us a little bit about yourself. How did you come to be in this kind of dentistry with this passion?
Well, thank you for having me. I've always had an interest in whole body health and oral systemic wellness, and it is becoming more and more apparent every day how much the rest of the body, systemic diseases, are connected to the mouth. So I knew when I started my practice that I wanted to integrate the two and learn more about my patients' general conditions and not just be a typical drill and fill dentist. So that's where I am.
That's great. So you weren't always a dentist, were you?
I wasn't. No, my first career was interior design. So I had a early career change, decided that wasn't what was best for me. And after 6 years in that field, decided to go back to dental school, and so happy that I did that.
I think that's really wonderful. So you can feel when you're making a big impact in people's lives if you're helping them to improve their health or to prevent certain health issues because of teaching them great oral care.
For sure. I definitely had some personal impact from both my mom and a personal friend when I was doing interior design. Both were sick and not doing well, and just watching their doctors interact with them, I had this calling, I guess. I just noticed that those doctors and physicians were making a real impact, I felt, and I wanted to be able to touch people in that way. So
that's wonderful. So do you find that your patients are fairly open to the information that you have, the passion that you have that describes?
Some are, yeah. It's a tough paradigm switch, I think. A lot of the general public has become used to going to a dentist and purely talking about teeth and gum tissues, and that's just the way that our society has become. And so there is a little bit of an obstacle, I think, for me, just trying to introduce the subject or just bring up little things at a time, so that I don't overwhelm my patients on our first date, quote unquote.
Interesting. Well, do you find, I loved your video and the challenge that you put out for people to use the interdental picks. Do you find that flossing, if people are doing it correctly, is as helpful as using the interdental picks? Or are the picks really a much better alternative to getting into all the right places?
I think this is going to be an unfavorable answer, but it's actually the more you can do, the better. The floss has the benefit of wrapping around the front sides of the teeth, getting underneath the gum tissue on, say, the cheek side, the tongue side, whereas the interdental pick really, it does a great job, but purely in between the teeth, and it doesn't really wrap around those front and insides as well. So I tell my patients, do whatever you can. Doing something is better than nothing. Finding something that works in your hands is going to be most beneficial. But if you can get more than one thing in there, all the more power to you.
Okay. So how about electric toothbrushes and water picks?
Both very helpful.
Okay.
Both very helpful. So the electric toothbrush is shown to be far more effective than a manual toothbrush, not just because, the vibrating factor will help remove plaque and build up, but also having a timer built into it really encourages people to do the full 2 minutes. And in some cases, 2 minutes is just a guideline. We use plaque disclosures in our practice to show patients the areas that they're missing. And so really and truly, whatever it takes to get to all of the areas of your teeth is what's most important.
Oh, that's great. I love an electric toothbrush, and it's been a helpful tool for my children. So
yes,
I see that would be a benefit to most patients. for sure.
Yes,
So
definitely.
how can patients know when there's a problem in their mouth, aside from, pain? What are you finding are the easiest symptoms to lead you to help a patient improve their oral health?
It's actually kind of difficult because some of the signs, what we were talking about in the video have to do with periodontal disease or the beginning of periodontal disease and gum disease. And a lot of that is silent up until the point when it's too late. But early signs and symptoms would be bleeding. And what we like to tell our patients is there's no such thing as a little bit of bleeding. If you take the square, the surface area of all of the gum tissues in your mouth and add them up, try to imagine something the size of the palm of your hand. And if you had bleeding the whole palm of your hand, that persisted on for more than a day or so, you would be concerned. And I think we forget that. We tend to forget that quite a bit. Oh, my gums bleed from time to time. It's not really a big deal, but there's no amount of bleeding that should be considered normal. If you have one spot that bleeds on occasion, maybe something got stuck in there, popcorn kernel or plaque just sat there too long. But I would just say take into account that if you ever have any bleeding in any spot, it's because there's something there that shouldn't be.
Okay.
Yeah.
Are abscess teeth, or abscess is not the teeth, but are abscess areas related to this as well?
They can be. They can be. So an abscess can either be a tooth infection or a gum infection. And if it's a tooth infection, more than likely you will have pain. And but that's not always the case. And if it's a gum infection, same thing. Sometimes people feel pain, sometimes they don't. But either way, if you notice puffiness, swelling, or a bad taste in your mouth, all of those things should be looked into.
What causes an abscess? What's the original reason for that?
Bacteria based. So if it's there's a couple ways that the bacteria can get in. It can either get in through the tooth. Say you had a cavity that worked its way down to the nerve and then down to the root of the tooth. That can cause an abscess down at the root of the tooth. Same thing if you've got a gum infection or you have loose gum tissues, bacteria can work its way down into the gum tissues and cause that infection as well.
Do you find that some people may be more prone to these things, even if they have really good oral habits?
Yes and no. So much that we have in our dental world is preventable. So what I find is that some people will have more susceptibility to decay than others, and some will have more susceptibility to gum disease. But if you know what your risk factors are, they're doing proper home care, taking the time to keep everything properly clean is going to prevent majority of those ailments.
Okay. You mentioned in your video about some tests that dentists can do that help look for these bacteria in the mouth. Could you talk a little bit more about those tests?
Yep, it's a salivary DNA test. And basically, there's a couple different companies that we work with, but it's in one case, it's taking a saltwater sample and you swish it for 30 seconds and spit it back in a tube. We send that off, and the lab sends us back a bacterial analysis. And that will say you've got certain levels of bacteria that are above the recommended threshold. And another option that we do, same type of process, but we're actually checking in the gum tissues and on the base of the tongue, which is where bacteria tend to live in great amounts. And we send that same thing off. We'll send that off for a result and make recommendations to our patients saying, oh, well, you've got some of these bacteria are super, super high, and they tend to be the ones that cause the most disease.
Okay. Do certain lifestyle habits lead to different kinds of bacteria? Are you seeing a connection with, even if someone has good oral habits, like, they're good about flossing and brushing, are there other lifestyle habits that will impart the harmful bacteria?
Definitely smoking. Smoking, tobacco use are definitely very high risk factors as far as gum disease and tooth decay go. And then a high sugar, high carbohydrate intake. But the other thing is that I do tend to meet some patients that don't tend to eat a lot of sugary things. They eat pretty healthy, and they do have good home care, kind of like you were saying, and they might still have periodontal disease or the beginning of periodontal disease. And one of the other things that we can test for with those salivary samples is to find out if you have a genetic predisposition to inflammation, and your body just reacts stronger than somebody else would.
Okay, interesting.
Mm-hmm.
Now, the tobacco even plays a part.
Mm-hmm.
What are the best foods? I mean, I don't know if you talk with your patients about their diet in addition to the lifestyle habits of just keeping really good oral care, but do you talk to them about food? What are the best foods they can eat in order to improve their oral care?
I definitely recommend fruits and vegetables and things with a high antioxidant content. There have been a lot of studies showing that having a high level of antioxidants in your blood can actually prevent a lot of the diseases that we're looking at in the mouth.
Okay, that makes sense.
Yeah. And then the other important thing to know is that every time you eat something that has a carbohydrate in it in your mouth, it gets broken down into an acid. The bacteria in your mouth tend to take that and they thrive off of it. So I will tell our patients, if you're having something in between meals, to try to stay away from carbohydrates, maybe have some nuts or just something that's more protein rich through like in those in between meal times, just to give your body a chance to keep the acidity level from dropping down too low.
Okay. What would you tell people in addition to that to avoid? What kinds of foods? Or I remember a joke, but that isn't really a joke, from a pediatric dentist who's a good friend of mine, saying that gummy bears can help keep a pediatric dentist in business.
Yeah.
Say that there are definite foods that we should all avoid?
Yeah, I think candy is kind of the obvious. Sticky caramels, things like that are the obvious answer for a dentist. But I think what a lot of people don't know is that crackers can be more cariogenic, more cavity causing than candy can at sometimes. If you imagine like a goldfish cracker, which kids tend to love, those goldfish, we see them all the time stuck into the grooves of the teeth. And so if you're going to have a bread versus a cracker, I definitely say go with the bread because it's less likely to get stuck into the grooves of the teeth.
Okay.
Yeah.
I hadn't thought about crackers before.
Yeah.
What age do you recommend children start flossing or using the picks and trying to work better with their own mouths?
As soon as those teeth have contact, we tell the parents to help them get in there with floss. When the baby teeth start to come in, a lot of times there's gaps in between them, which is great. That makes the teeth naturally cleansable on their own. But once they have that tight contact where they're touching, getting something in there to clean in between them is necessary.
So they should even be doing that with their baby teeth. They shouldn't wait until they've gotten their permanent teeth in.
Correct.
Okay.
Baby teeth are very important as far as maintaining space and health for the adult teeth. And unfortunately, we hear it quite a bit. Oh, it's just my kid's baby tooth, that we don't really need to worry about it. But if that tooth gets an infection, the adult tooth is likely to, become either infected itself, or you might lose the baby tooth and eventually lose the space for it later on. So very important. And the other thing is that we have a microbiome in our mouth. Bacteria live here, and it starts from day one. And if you allow a cavity to sit there in place and just kind of fester that bacteria and grow the bad bacteria in the mouth, that's going to change their entire life.
Interesting.
Yeah.
I hadn't thought about that at all.
Yeah.
Well, so if you had a new patient come in, would the recommendation of brushing twice a day and flossing or using the interdental picks and combined with a healthy lifestyle, like a good healthy diet of fruits and vegetables and whole grains, do you find that is probably enough to keep someone who isn't predisposed? Is that going to help them keep a really healthy dental environment?
In most cases. And again, we always would like to check and say, okay, are you missing any areas? You might you're doing a great job. You're brushing 4 times a day, but look at these areas that you're missing along the gum line. But if they're being effective, as far as that goes, there's a couple other things like a dry mouth that could cause problems. The other, as far as decay, the other thing is oral appliances. If you have like a partial, or if you have retainers that you wear at nighttime, those can also potentially cause decay as well. So it's different for everybody. It's really hard to say.
Okay.
You're doing a great job, but they might have other predisposing factors.
Okay. Have you seen some big health changes in your patients after they become aware of the connection between their oral health and their whole body health?
I have. One of the big changes that you can see is somebody that has a problem controlling their blood glucose if they have diabetes. And a lot of times there's a big connection between gum disease, periodontal disease, and diabetic glucose control. And once they're able to get their oral conditions under control, their blood glucose is able to get under control as well.
Wow.
Yeah.
That's a connection I hadn't considered yet either with diabetes. So what kinds of food do you like to eat at home? What do you like to prepare?
I am a big bean burrito fan. Yeah, I tend to eat a lot of more Mexican style foods with beans and rice and lots of vegetables, salads, those kinds of things. But I'm also a big fruit eater. I love most fruits.
Do you think that some of your patients worry about eating fruit because of that, that presumption that the sugar in fruit is also going to be bad for them, like the sugar in candy? Do you run across that?
I haven't encountered that too much. I have heard that, but not from any of my patients, thankfully. And the thing, I tend to tell our patients, you're going to get more antioxidants from that than you are going to have a risk from decay.
Mm-hmm. Right. Now, do you feel that other dentists are coming around to this same information, or is it a little bit harder for colleagues to understand if they haven't had some reason to find this connection in their own personal life?
I've seen both sides of the spectrum. We are, in my office, we go to a meeting called the American Academy of Oral Systemic Health. So we've done some great networking there, met a lot of people that are really on the cutting edge of integrating the two. But then again, in day-to-day real life, I do see the other side as well, where it's just it's just a tooth. It needs to be taken care of, and next year we'll have to do just another filling on the same tooth, and we shouldn't look into what the connection is there.
Are you in a solo practice there, or
Yes.
Do you have partners? Okay.
Solo.
Gotcha.
Yeah.
Did you learn any of this in dental school, or was this all because of your own passion?
Some of it came up in dental school, but not to the point where, it really meant anything. And shortly after, that's a good question. I can't even remember how I came across this, but something sparked an interest for me. And, as far as my own personal health and learning about diet and nutrition, I just started to put it all together, and luckily found some good groups and organizations that I could join that I really honed in on.
Do you have a support group there in your city for people who are interested in total body health, as related specifically to like whole foods and a plant-based diet or anything? Do you have groups like that you attend? Or
So Dr. Feinsinger, actually, who's done a couple videos for the group here, is about 30 minutes away from me. So we have a nice networking opportunity where he and I send patients back and forth.
Oh, that's great. Yeah, we did. We had a pleasure of having Dr. Feinsinger on before. That's great. Well, do you have any other success stories from your patient base that you could share, or any anecdotal stories about patients who've had the light bulb come on?
Let me think. Most recently, it's just I've had a couple patients that have just they've had a light bulb go off, but we haven't seen a difference, in oral health care yet. But they've said, oh, I read the China study, or I am reading How Not to Die, and I'm so excited about it, and I want to make all of these changes with my diet. But I have one patient who is looking to actually start a nutrition counseling group here in town as well, and just to see her light up like that. And I can actually think of 2 patients that has happened with, and to see them kind of want to take the torch and just start teaching other people is really, it kind of warms my heart.
Absolutely. That's the best thing ever, is to see when somebody's gotten empowered.
Yes.
So so they'll actually be teaching other people. They're not just keeping the knowledge to themselves. I guess you find that easily. Once we learn it, we want to stand on a box and shout it.
Yes.
Well, what are your plans in the near future do you have any special plans with encouraging more of your patients, or starting a support group of your own, or hanging in the same support group still with Dr. Feinsinger? What are your future plans? We
actually have just made kind of a schedule for next year for 2019 for our office. We're going to start doing monthly educational events here in town. And they're not all going to be nutrition based, but a lot of dental and nutrition. And I think at one point we'll try to reach out to Dr. Feinsinger, see if he's available to come and speak about heart health, but really reaching out to the community on a regular, consistent basis so that we can just help spread the word and become more known as a place where you can come to for answers, not just about oral health, but also about whole body health.
That's wonderful. Well, let our listeners hear where they can reach you, and would it be okay for people to contact you and ask questions? Let us know about the ways to get a hold of you.
Okay. My email address is roperdds@gmail.com. So that is a great way to reach me. Also, the phone number, if you want to call us, is 970-984-8252. And you can speak with any one of us that answer the phone, but the message will get relayed to me. We have a Facebook page for the website, or for the office. That's Newcastle Dental. I want to say it's NCCO Dental, but if you find us, you'll see a picture of a beautiful downtown red brick building with a red truck out in front of it. So that's us.
And I like your logo, the horn with the tooth.
Thank you. I worked hard on that.
That was very clever. Well, are there more things that you would like our listeners to think about, to know? Any more wisdom to impart?
Not at this time, no.
Well, we thank you so much for giving us this time today, and for preparing your video for us, and sharing your favorite resources on our website. I'll leave it over to Lynn. Do you have any questions for her, Lynn? All right.
I love what you guys were talking about, and I loved it when Dr. Roper was talking about some of our patients that found the books, How Not to Die and the China study. What are some of your favorite books? If you were to get someone started in that direction, what would you lead them to?
I do really like that How Not to Die book, because it's kind of like a reference manual. You can just use the index in the back and just pull up one topic that you're looking for. I have to say, I read the China study many years ago, but it's a in-depth read, so I would not start there. But I definitely, if you haven't seen the videos yet on Netflix, the documentaries like Forks Over Knives, those are also great places to start. I think good entry-level videos to get you interested.
Great, because that was going to be my next question.
Yeah, sorry.
Okay, well, thank you so much, Dr. Roper. This has been so insightful. You know, I can tell you honestly that there are probably more people that don't recognize what's happening in their mouths that affect the rest of their bodies. And this is so enlightening. Thank you so much for being here with us. Lisa, way to go, girl. Good
Thank you
job.
so much.
And
Thanks, Lynn. And thanks,
Thank
Dr.
you.
Roper. It was a pleasure.
Yes, thank you both so much. I appreciate it.
Sure.
yeah, so thank you. And thank you to our audience for joining us. You'll be able to find the video on the website, and please like the video, subscribe to our YouTube channel, and we'll see you with the next video. Thanks. Bye for now.
Thank you. Bye.